A 56-year-old lady came to see me recently. Her knee was painful, swollen, stiff. Her MRI showed grade 3 osteoarthritis. She was overweight. Naturally, she thought I'd spend the consultation looking at her knee. Instead, I asked her about her waist. I asked whether she had a fatty liver. She looked puzzled. Doctor, I have come because of my knee. Why are you asking me about my belly? That's a wonderful question. Because your knee doesn't live alone, it lives inside your body. And your belly may be having a conversation with your knee every single day. For many years, we thought body fat was simply a place where extra calories were stored. Today, we know something very different, especially the fat deep inside the abdomen. What doctors call visceral fat behaves like a living organ. It has its own blood supply, its own immune cells, its own chemical messengers. It spends the entire day talking to the rest of your body, including your knee. In our last two videos, we met the maintenance engineer of the joint, the cell that spends the whole life listening for danger signals, and in who keeps ringing the alarm. We learned that not every alarm means real damage. Some alarms simply won't switch off. Now imagine your belly joining that conversation. If you carry too much visceral fat, it begins sending more danger signals into your bloodstream. Not because you are sick, not because you have an infection, but because enlarged fat tissue develops a low grade inflammation of its own. Those signals travel everywhere: the heart, the liver, the muscles, the brain, and yes, the knee. The maintenance engineer inside your joint is already listening to signals from the cartilage. Now it's listening to signals from your belly too. Your knee doesn't just react to what's happening inside it, it reacts to what's happening around it. This surprises many of my patients. The liver isn't beside the knee, yet large population studies are now finding they sit on the same metabolic map. Large studies link fatty liver to a higher risk of knee arthritis, not as a direct cause, but as a shared metabolic pattern. A fatty liver is often a sign that your metabolism has shifted, and a shifted metabolism means more inflammatory signals reaching an already irritated knee. That is why I don't look only at the knee. We'll unpack the fatty liver connection properly next month. For today, just remember your liver and your knee may be reading the same report. I often see two patients, both with the same x ray, both with grade 3 arthritis. One walks comfortably, the other struggles to climb stairs. Why? Sometimes the difference isn't the x ray, it's the biology. One knee lives in a quiet biological environment, the other is surrounded by inflammatory signals arriving from several organs at once. Your scan is not your story. Now, let's be careful here. Not everyone who is overweight develops arthritis. Not everyone with arthritis is overweight. Not everyone with a fatty liver has knee pain. Osteoarthritis is far more complicated than one cause. Mechanics matter, alignment matters, old injuries matter, the meniscus matters, the bone beneath the cartilage matters, but modern research is teaching us something we can't ignore. Your metabolism matters too, and if we ignore it, we may miss an important part of the story. So, the next time an orthopedic surgeon asks you about your waist or your fatty liver, don't be surprised. He hasn't forgotten your knee. He's trying to understand who is talking to it. Because before I decide how to treat a knee, I first want to understand who is speaking to it and how loudly. That raises an honest question with so many signals converging on a single knee. Is PRASAD right for every one of them? Next time, I'll tell you exactly who PRASAD is not for. I am Dr. A.K. Venkatachalam from the Madras Joint Rejuvenation Center.